In the next session, the experts will deliberate about entrepreneurship and how they are trying to disrupt the status quo of the segment. As a continuation of IVF clinics are now burgeoning even Tier 1 and Tier 2 cities, the panelists will discuss how entrepreneurs are looking into this as a business model and how IVF they should put patients first and improve the quality of care. How they are making this segment more affordable.
Good day, everyone. Yet another good panel discussions we will be having now in ET Health World Fertility Conclave. The topic is how entrepreneurs can move IVF into future. So why this panel discussion? Why this topic we have chosen? Because as we all know, as a concentration of IVF clinics are now burgeoning even in Tier 1, Tier 2 cities, and the panelists here will be discussing how the entrepreneurs are looking into this as a business model and how IVF should put patient first and improve the quality of care, and how they are making this segment more affordable, and how entrepreneur space is evolving in IVF. That's the whole point of coming up with this topic. And we have a great panel out here who will be discussing for the next 50 minutes about this topic in detail. We have Dr. Aniruddha Malpani, Medical Director, Malpani IVF Clinic, Mumbai. Thanks a lot, Doctor, for accepting to be a moderator of this session. Looking out for your questions and to the panel out here. Then we have Dr. Madhuri Milind Patil, Clinical Director, Dr. Patil's Fertility and Endoscopy Clinic. Thanks a lot, ma'am, for coming in for the discussion. Next, we have Dr. Parikshit Tank, Treasurer, FOGSI, Consultant Obstetrician and Gynaecologist, Art Specialist, Ashwini Maternity and Surgical Hospital. Thanks a lot, Dr. Tank, for coming in. And next, we have Dr. Basab Mukherjee, Senior Consultant, Calcutta Medical Research Center, Department in Obstetrics and Gynecology, and Vice President of FOGSI. Thanks a lot, Dr. Basab, for making out the time. And we have Mr. Anubhav Prashant, the CEO of Apollo, Cradle, and Apollo Fertility. Thanks a lot, Mr. Prashant, for taking out time. And over to Dr. Aniruddha now for the discussion.
Okay, one thing I'm going to promise you guys, we're going to not be boring. We're going to try to make sure, since you have so many different panelists with so many different perspectives, to make sure that we add some value to your life. Doctors don't traditionally think of themselves as entrepreneurs, do we? We think ourselves as professionals. We pride ourselves in the fact that we came first, we pass all these exams, our academic grades are so good. When you go out into real life, no one's really going to ask you whether you came first in your MD or whether you came last. You need to run that practice well. And that's exactly why we're using the word entrepreneur here. Now, the fact of the matter is that it's an extremely competitive field. As Madam pointed out, tumko har gali aur nukkad mein abhi IVF clinic milne wala hai. And times have changed. It's no point talking about how practice was 50 years ago and it was very gentlemanly and you had a family doctor who would refer patients depending on what was required. Everything has changed. Patients have changed, doctors have changed, Dr. Google has changed lots of things. You can't put the genie back in the bottle. So we need to discuss what doctors can do in order to adapt and what we need to do in order to make sure that our patients get good quality treatment. I mean, that's the reason we became doctors in the first place. So I'm going to start kicking off. And one of the first things is, in the past, let's say 50 years ago, most clinical practices were owned by doctors and run by doctors. Today, everything has changed and lots of clinics are now run by corporates. Either you have a box in a box model or you have a chain which will only run IVF clinics. What do you think the impact of this has been? We'll start with ladies first, Dr. Madhuri.
What I feel is with the corporates coming in, it's become more like a business. Otherwise, when we have, at least I have my individual clinic, but it's still, it's a patient-to-patient interaction and we look at the interest of the patient. But that is lost when the corporates have come in. And what the corporates look at basically is the numbers. So many a times this leads to having unindicated IVFs or, if the patient would have conceived with a a better, less invasive technique is subjected to IVF. And I've also seen, especially in corporates, that just with one failure, two failure, the patient is advised either egg donation or she's advised surrogacy, which I think is totally wrong, because I've had patients who have been advised egg donation and just conceive with a plain IUI. So I think the corporate should look at the patients as a patient and not as a business, because we know that these patients, because of the social stigma they have, especially in a country like India, they are going through emotional as well as psychological stress, and then they also go through financial stress, because there's a large strata of a patient who are still middle class, they're not high class, and they really have to spend out of their pocket, or at times even they take loans and come. So I think this is a very important fact which we need to keep in mind when we start IVF practice, and especially when it is in a corporate hospital, wherein they look look at it more as a business to make money, and therefore we have having so many international companies, financial companies putting in money over here for IVF. And I think they think that it's going to give us a lot of money, and therefore therefore there's also a lot of disconnect which has happened between the patient and the doctor, and the patients tend to less believe the doctor because everyone tells a different thing, and plus the website tells different things, plus we have, as you said, Dr. Google. So I think the connect between the patient and the doctor, especially when we are doing IVF, that is for infertility practice, has to be there.
But Dr. Madhuri, I'm going to play devil's advocate. I'd agree with you, but on some hand, people are going to say, hey, where are all the dinosaurs? This would be perfectly okay 30 years ago. There are lots of advantages to having a large corporate hospital setting. There are efficiencies of scale. You can keep costs down. So Dr. Anubhav, I need you to be able to tell us why.
I don't think the costs are down, okay? The cost at a corporate is always more than your private clinics.
But let's. I'm sure there has to be a reason why these corporates are being so successful. So let's ask Dr. Anubhav, what's your take on this? I'm sure you heard this criticism before.
No, I think thank you for that, Dr. Aniruddha and Dr. Madhuri. This is very familiar term. I think, in my view, what's happening with the IVF space, and I will not call it industry because that's the wrong connotation, is what happened with a lot of other specialties. I started my journey with a large tertiary care hospital. And when we used to review, or as a business review, the whole obstetric and gynecology field was probably, left in footnotes. It never, because obviously the larger focus was on the larger tertiary care specialties.
So it didn't generate enough. It didn't generate enough revenue for management to be too involved. हाँ ठीक है बच्चे deliver करते रहो, step करते रहो, कोई फर्क नहीं पड़ा. Okay.
It was like that, yeah. But what's happening is, like you have seen single specialty setups coming in cardiac. You had Narayana's success. You had eye setups which have grown. You have SCG, which is consolidated onco. I think a similar trend is being witnessed in the whole assisted reproductive space, which is where a lot of consolidation is happening, which is where a lot of interest, both from the, I will say corporate hospitals, but more organized players. And even for that matter, setups which have been run by doctors themselves, they are looking into expansion and setting up their own chains. So I think it's a natural progression of any specialty, if you want to look at from there. The timelines are more aggressive now, and hence the interest levels. And what has also changed over the last 15, 20 years is now patients have a lot more options. Options give rise to more competitiveness, both amongst the doctors themselves, amongst the chains. Competition also gives way to increased stress and focus on how are you, alike. So like Dr. Aniruddha would say, you take out the brand names out of the advertisements these days, every single brand would probably look alike, right? And that's probably being, pushed for the need that everybody wants to look competitive, wants to look attractive. And then hence there is a resultant pressure on cost, on a drive to drive quality. So I think it's only a phase of consolidation that the whole IVF space is looking at right now.
So, Dr. Parikshit, you've been you're a second generation doctor. Dr. Tank was a professor, teacher, someone he respected, and you've seen how medical practice has changed. And, you could call it an evolution. Some people may not necessarily treat it so kindly and perhaps say, what's happened is people don't trust doctors anymore because everything has become so much of a business. What's your view about this, and would you agree?
First of all, I want to say one very important thing that business and being a good doctor don't necessarily oppose each other. Let's have this concept very clear. So why should we look upon it in that sense that we are talking at loggerheads when we come, when we are saying evolution, why don't we use it in a positive way? Let us understand that there have been a lot of positives which have happened over a period of time. Most doctors are practicing in a more evidence-based fashion than their predecessors. The type of technology standardization, what is there, even in private hospitals today, is much better than what it was, say, 10, 20 years ago. So
that's true in government hospitals also. Why would you give credit to a corporate hospital?
I think let's leave government hospitals out of the discussion today, Dr. Malpani, because I think there are hardly any IVF.
No, I'm not talking just about IVF. I'm saying in general, just like academic medicine has evolved, a lot of that evolution has occurred, and IVF has been one of the beneficiaries of it. That's all I'm saying.
Absolutely.
Okay, go ahead.
So, sorry. Yes, I mean, there are some positives which have happened over a period of time.
Yes.
But yes, there has been more commercialization, and this is true for each and every medical space. This is true for each and every space in general in the public domain. So I think we are coming closer to the concept that there's no free lunch. I think that's what has to be put across and should come across to the general public. There was a lot of free lunch, free service, which was expected in the medical profession in the past, which today is not acceptable to the medical profession, to doctors. And that somewhere is, it could strike a note which is unsavory amongst the public. So that's what I would say in terms of the evolution or change, what I've seen over a period of time.
So Dr. Basab, Parikshit brings up this great point, is that obviously things are going to change, evolve. Medicine is not living in its own bubble, neither is IVF within its own bubbles. And just as society evolves, everything else is going to evolve, and we need to adapt to this. What are the good things, perhaps, which individual stand-alone IVF clinics run by clinicians perhaps can learn from the ones which are run by large corporates or, perhaps corporate chains?
Thanks, Dr. Malpani, for the question. I think just going back to some of the discussion which has already happened, is that the good things about corporates, which I think is something which we must mention, is the SOPs and the systems in place. I think those are the systems which individual doctors would not have been able to do themselves, and that's something which definitely we need to learn. And some of this also is driven by the quality standards which they need to have, like an NABH or NABL back to their back, which gives them better advertising scope. Also, the use of digital technology has been leveraged most excellently by corporates, which again, doctors have been a little late to pick up. So that's another thing about use of digital technology, which is invariable and inescapable at this present age and time. So I think those are some of the things which there's a lot of things to learn from corporates, and these are the things which we can learn. Also, people demand 5-star hospitals. People demand 5-star care. This is something which a normal doctor.
The trouble is they want 5-star care at 3-star prices.
That's true. But at the same time, there's always a market for the Medantas. There's always the market for the Apollo Indraprasthas. There's always a market for that platinum wing there.
But Basab, I'm sure your professor would be turning over in his grave if he heard you talking about patients and markets, because that's not the way, whether you like it or not, that wasn't our worldview when we were young doctors. That's perhaps not the reason why we joined medicine. And some of it just sounds a little bit foreign. Would you agree with me?
Again, going on the same point, Dr. Malpani, you said that how can doctors be as entrepreneurs? So entrepreneurs and doctors, that's not what you're taught in your medical syllabus, neither in undergraduate nor in postgraduate. But unfortunately, when you become a doctor, a medical doctor, with the little intelligence you have, you can really adapt it to be a fairly good entrepreneur. If you want to adapt it that way, some of the intelligence can also be diverted and you can use that in that particular way. But a lot of people are not interested. A lot of people are not sure of themselves, and that's why doctors don't make great entrepreneurs most of the times. So that's the reason why the corporates over the last 50 years, as you rightly said, crept into that space, gradually capturing the space. So doctors are very much responsible for corporates governing the medical industry today. And I agree with Dr. Madhuri, as she rightly said, that a lot of it is profit has been a big drive about this. And once profit comes in, unethical practice invariably creep in. So, and the brand promotion becomes like the key. I want to promote my brand irrespective of who's under it, because the people under may keep on changing, but the brand is permanent.
So I think that's great. I think, as Dr. Parikshit said, that competition can actually bring out the best in everyone, or it can actually bring out the worst in everyone. And perhaps to your point, Dr. Basab, because we've not done a very good job as a medical profession in regulating some of our obvious bad apples, as a result of which a lot of that has been exposed to abuse. And any patient is going to say, any patient who's had a bad experience with one doctor is not going to trust any other doctor, whether it's a corporate hospital or whatever else. And unfortunately, patients don't know any better. And I think that's where people like you come in, Dr. Madhuri, because you take pride in the documentation.
Just one point about bad apples. I think every profession has bad apples. True. Only medical is in healthcare. You're sort of whenever you are there as a doctor, put your next into the name, a halo suddenly gets put up by not more than you, by the community. And once that halo starts getting busted, then is when when your rotten apples come into the prominence. Every profession has rotten apples.
Yes, but the problem is we like the halos. No one is going to get up and say, hey, we don't deserve the halos. Yes, everyone likes being treated as God. And then when the same God is treated as a devil, then you object. So I think if nothing else, we should also be very consistent in our messaging. But go ahead, Dr. Madhuri.
In general, I think probably the medical profession needs a reality check, in terms of getting a little more grounded than what our previous generations were. And I think Basab will agree with me, because he's also a second generation doctor. And he's also grown up with more or less the same background as Dr. Malpani and me. I think we've all grown up in the same, medical background. But I think it's time to realize that we are professionals. We are doing a duty. We are doing it to the best of our abilities. And that's just like maybe other professions as well.
Dr. Madhuri.
I'd like to make one point what Dr. Basab said about SOPs. So I think most of our IVF clinics, at least about 50% of them are accredited. And I think all accredited clinics do have their SOPs. Yes. I think even when I was practicing in the second or a 3-tier city like Sangli, I did my practice there for 10 years. I had an IVF clinic there. And my clinic was ISO accredited. And it was probably the first in South Maharashtra.
I think his point is that it was the corporatization.
It depends upon the individual, whether they want it accredited or not. Or whether they want
but that's the point. Effectively,
how they want to practice.
But you effectively had a Wild West in the past, where you had multiple cowboys doing exactly what they wanted. And that it didn't really matter if you had the established name or the brand name, or you were the doctor which everyone wanted to, you could do whatever you liked and no one would ever bother to check. And thanks to all these corporate hospital settings where there is a certain degree of supervision, so enlightened doctors like you, Dr. Madhuri, chose to do it for themselves. What's now happening is once people have been exposed to some of this stuff in a corporate hospital setting, when they start practice, even on their own, they will adopt some of these measures for themselves. And I think definitely that's a healthy trend. But let's talk a little bit about some of the unhealthy trends with some of all this competition. It's not like there wasn't competition in the past. Even 50 years, doctors would compete for patients. None of that has really changed. But I think a lot of it now, partly because of the corporatization or the advertising, has become much more in your face. How do you deal with that, Dr. Madhuri?
Again, that is, I think, individual perspective as to what that person wants. Like for me now, for the last 40 years, I'm in practice, and I don't think I've ever done any cut practice or I have advertised myself. and whatever patients I get is patient to patient. Now I can tell, because initially when I shifted from Sangli to Bangalore almost 20 years back, I was the third IVF clinic in Bangalore, and I used to see almost about 70 to 80 patients a day. But today there are almost 200 IVF clinics in Bangalore itself.
Really? How many of them are ICMR? How many of them are on the ICMR?
I don't think more than 8 to 10 are ICMR accredited.
Wow.
And what I have seen is that any gynecologist just thinks that they have patients and they start, but you must look at the treatment, what is given to the patient. And as we always take a oath that we should not criticize anybody, we really cannot even tell the patient, no, this was wrong. We said, no. I said, no, we can try one more time. That's what we tell our patients, because it's totally wrong to tell that whatever treatment they've taken is not right. Secondly, now we've started having so many, like during my time, if I had to really start an ART clinic, I had to go abroad to learn about ART. But today we have so many options which are open. And I myself run teaching programs at my clinic, wherein I have a university run program, which is almost 18 months. And I also have the FOGSI ICOG program, which is just 6 months. But what I feel is nowadays people don't want to take the 18 months because they just want a certificate and they just do the 6 months. They're not really interested. Once they get a certificate, they just open whether they know or they don't know. They're really not bothered. We also have several clinics all over the country wherein they're offering a weekend course. So what can you learn IVF in a weekend? Can you learn? No, I don't think. And I think I've changed my treatment protocols over the years. I keep on changing. You read, you look what the newer evidence has come. And I think that's also very, very important. And these multiple chains, what they think, I mean, they just have the name. But what about the doctors practicing under that umbrella? Whether they're really knowledgeable? I really question that, because and they just give a protocol which probably has to be used for all patients. But one must remember that one size does not fit all. And the treatment has to be individualized if you have to have a good success rate. And projecting your success rate, which is not really what is there, is the other thing which we need to look at. So,
Parikshit, you've been very active with the FOGSI. And I think part of the compact between a profession and society is that patients trust you, that you will self-regulate. And as Madhuri is very clearly pointing out, obviously the self-regulation has failed miserably. And again, it's partly because of Madhuri says, doctors see no evil, say no evil, hear no evil. So even when you can clearly see people are doing evil stuff, we kind of say, we pretend that that's not happening. And I think we've actually let our patients down. What do you think a solution is? Because at some point now the government is saying, you guys can't be trusted to regulate yourselves. So we will then put in that regulation.
Yeah, so I think, it's a fine line, or maybe I should say a big wall between see no evil, do no evil, that kind of an attitude, and becoming vigilantes. Because, it could just go the other way. Say, for example, there's somebody whom I don't like. And being an office bearer of the organization, I decide that, well, the organization should take some action against this doctor. So where does this go? How does this go forward? I think the best kind of a solution, or the best kind of an outlook to this is really still self-regulation only. I think that's the only thing which will work in the long term. Because
I'm going to disagree about that, but I'll come back. If self-regulation worked well, we wouldn't be in this situation, no, Parikshit? And the reality is that out of 100 doctors, even if 80 are fine and 20 aren't, it's usually those 20 who start, and then that's exactly how it spreads. So I'm sure Madhuri will agree with me that, I would even say 40, 50 years ago, no one ever heard about kickbacks and commissions and stuff like that.
No, today, I think it's a very age-old practice, which has been there since generations. So I don't think that is anything new, but I think what is new
is that has been only in Mumbai. It's
and I think it's become institutionalized, and you have rates.
Exactly. It was started by one of the eminent surgeons in Mumbai, and that's how it is run.
See, Madhuri is being so political.
Parts of the country,
she's being so politically correct. She's still not naming any names. And I guess that's part of the problem. But, be that as it may. But I think to your point, Parikshit, I think if we continue taking this approach, tomorrow, people who live in glass houses shouldn't throw stones. But part of the reason we have an organization like FOGSI is we expect FOGSI office bearers to be able to say, hey, that's not working well. What do we do? But Anubhav, I'd like to ask you, as Dr. Madhuri said, what happens is everyone attends a weekend certification course, hangs out a single and says, hey, I'm an IVF specialist. And one of the criticisms about corporate hospitals is you treat your doctors as widgets. If tomorrow it's Dr. X, it's going to be Dr. Y, people aren't coming to the doctor, they're coming to Apollo. Do you think that's a fair criticism?
I would not agree to that, because you in a clinical field you can't take away the clinician out of the equation. So whether it's a new setup, whether it's an old setup which has been running for years, you still need a good doctor to deliver good care. You can't do without a doctor. So yes, and there will be times where there is a transition of clinicians. One clinician leaves one board to the other, and those are normal practices. But what I think ensures that institutional practices run better is what Dr. Basab was saying. It's a more evidence-based practice. It's a more SOP-driven. Now, SOPs could be driven by individual doctors itself. Even for an individual entrepreneur doctor, let's talk. If I want to run my own setup and I want to ensure that my setup runs beyond what I can also foresee and manage, I will need to ensure that my team, and which is my junior set of doctors, follow the protocols I have set it. Now, nobody's questioning the kind of protocols that you said, unless there are protocols set in place, right? And that helps both, I will say, individual doctors as well as chains manage a scale operation better, and which in turn also ensures that outcomes are also guaranteed in a way.
I think that's a great point, and we'll come back to that. But Dr. Basab, I think what Anubhav said is so right. Individual doctors think of themselves as, captains of the ship, as rock stars, and that's exactly what you were taught in medical college. You've got to get the highest marks because you're competing with everyone else. Whereas when you work in a corporate hospital setting, it's much more a teamwork kind of approach, where you will have senior doctors, junior doctors, nurses teams. There's a certain degree of answerability. Is that something you'd agree with?
Yeah, I think the word which we sometimes very loosely use is corporate slaves, as some of the doctors, pardon my language, but at the same time, that is some part of the thing is true, where like doctors, a lot of doctors want to be demigods or achieve a demigod status because they want patients to come because you are there. I'm not sure how it works in the other parts of the country. My other panelists are from South and from the West, but from the East, I know that a lot of our patients come to us because you are so and so. And the reason why you do that is because you develop a practice over time, you develop a name and fame over time, and you want people to come to you because you are you. Because you, under whichever banner you are today, tomorrow, day after tomorrow, you will remain yourself, and that's why you want your patients in your clinic under your brand. And then if you choose to use one hospital or another hospital to do surgeries, to do clinic, that's fine. Because if it works the other way, when you want to put all eggs in one basket, suppose you sit in this corporate hospital, as Mr. Anubhav said, unfortunately, it's true that next day they'll say, where did these patients come from, doctor? Is it your patients? Is it the hospital patients? Then there's a tussle. Then they'll say, you give me so much of investigations. You're seeing so many patients. Where are your investigations going? It's a very natural question to ask in a corporate setup, because I've opened a lab there. I'm investing so much of money in the lab. It's NABL accredited. And now you're seeing 30 patients a day. Where are the investigations going? These people have to be done here because I've got my setup. So that's what the demand from the corporate becomes unethical. Some doctors say that you don't need so much of investigations to start with. And some say that they have a right to do it wherever they want. And then they say, no, that doesn't work, doctor. This is not the way how a hospital works. So that's from their point of view. That's from this point of view. And at the end of the day, the doctor gets disoriented, disillusioned. And the next day, he or she will leave the corporate. And then sometimes if they've spent 10 to 15 years there, they'll have nothing with them when they leave it. They'll have very few patients, start again from scratch. And that's the reason why people aren't exactly the corporate friendly to start with. But some people, when they come early from abroad, they want to join a new place, they want to build up with the practice. That's when they join corporates, and then they build up with the corporates and really go on. Other times, some other corporates just adopt a doctor, just catch him with the practice, and then merge them together. I think, Dr. Malpani, we're not using names here, but there are brands who just capture the doctor with his practice and just give it another coating and another name. So Dr. Madhuri wanted to make a point, I think, here.
I was going to give Parikshit a chance though. Okay, go ahead.
Anubhav was talking about SOPs, but the SOPs is for the procedure, what you're doing. It's not for the treatment, what you're offering to the patient. And that's a very important point I think you need to keep in mind, because even if you take the same patient, she's not going to respond the same in the next cycle, because one should know that each cycle, each patient is different and each cycle in that particular patient is different. So that is a very important point what we need to take into consideration when you talk about, because there's so many of these big brands which basically would say that, okay, these investigations have to be done, but these investigations are really not required for the patient.
But Dr. Madhuri, don't you agree that in a corporate hospital, there is a certain degree of oversight? Let's be honest, in Dr. Madhuri Patil's clinic, Dr. Madhuri is God. Whatever she says, she attends a conference, she decides, this is what I'm going to try for my patients. No one's going to challenge her, whether it's your juniors or anyone else. Whereas at least in a corporate hospital setting, whether you may agree with the outcome or not or whatever else, at least there's a certain process which needs to be followed. And I think that's something we need to respect. But Parikshit, let me ask you, would you suggest that a doctor who's just passed out from medical college should actually work in a corporate hospital setting for some time to get exposure to how to deal with fancy VIP patients? Because, in government hospitals, let's be honest, we honestly, I'm sorry to say this, but you're often taught to treat patients like dirt. And that's kind of, you need to unlearn some of those habits and perhaps learn good habits. And do you think exposure in a corporate hospital setting does some of that? What would you advise?
I think the same can be learned by accompanying any good clinician.
But a lot of good clinicians don't have the bandwidth to be able to, have junior doctors with them. I'm just saying. So what you're saying
what I'm saying is that it's not mandatory that one does that.
Sure.
Yes, of course, it's an option. I mean, it's a great option, especially if, say, it's a young doctor who's coming out from his post-graduation specialization and intends to start practice without any background. I think corporate hospital gives a great avenue to get things working. But I wouldn't say that it's the only way to go. I think it depends on going back to the core of what this panel is going to be about. It's the entrepreneur spirit of that particular individual, the risk-taking capacity, so to say, and to what extent the doctor can hold on before he starts seeing a reasonable flow of patients.
It's impossible for anyone to know whether a doctor is good or bad, no matter what their brand name is, whether they've got white hair, black hair, or whatever else. And that's why we need to remember that medicine is a service profession. We actually need to put the patients back at the center of everything which we do. And there are good ways of doing it and not so good ways of doing it. And some of the not so good ways of doing it is obviously, instead of waiting for the patient to come to you, you go to where the patient is. You hold a free IVF camp. तो कोई भी बकरा आ जाएगा उसके लिए IVF करो. Or on the other hand, you make sure that your patient has realistic expectations of what you're doing. What is Apollo doing for making sure that patients know exactly what they're signing up for, Anubhav?
So I'll just answer to and maybe comment to where Dr. Madhuri probably left also. I think the key question for doctors who are trying to evaluate the question whether they want to start on their own or versus latch onto a corporate. I think the bigger question is nobody's sort of disputing that you should not make money, right? That is one. You need money to sustain even your own setups, right? Where I think the line starts, becoming gray is when it becomes, like you said, unethical practices creeping in, greed creeping in. So, and you have examples in the whole IVF industry itself, where doctors have went on to become good entrepreneurs. They run very successful chains. And yet at the same time, you have examples of doctors who have not been so, I'll say successful, not as successful in probably scaling up or maintaining the same trajectory year on year, right? I think that's where probably, picking up threads of what makes a good institution run, which means you have a revenue versus a cost sort of a balance so that you don't run into, like you said, fatigue, right? That is very important for even the young doctors who are sort of looking at setting up their own, or even for seasoned doctors who want to probably look beyond what they've already established. I think it's a very reasonable and fair question to ask.
So Parikshit, is it harder for an individual doctor to be ethical? Or is it harder for a corporate doctor to be ethical? Because, you'll have temptations no matter what. What do you think?
No, I think that's I don't think anyone can generalize and give you an answer for that. It really all boils down to an individual.
Basab, do you think doctors can be trusted to self-regulate? Let's be honest. I mean, we all see patients who've done IVF cycles in other clinic. And sometimes when you see it, you say, God, what is this doctor doing and what are they subjecting this poor patient for? So I understand that self-regulation would be, perfect. But the reality is it doesn't work very well in real life. What would your solution be, Basab?
I won't agree. It doesn't work in real life. I think it depends. Again, I agree with, Dr. Madhuri and Parikshit about it depends on the individual. What background have they done their medical studies from? What is their family background? What have they grown up to see? And how much of importance has money and profiteering happen in their lives? I think a lot of things go into the mindset of an individual before they enter into the clinical practice. But generally speaking, if you don't have that behind your back, it depends a lot on how you grow up, where you do your medical schooling from. One point I wanted to take, Dr. Malpani, is about wherever you do your medical schooling from, profiteering and money making doesn't come into the picture in medical colleges. I think it has to be as sacred as a temple. It has to be pure studies and the patient and the other person. That should and will never change.
Let's look at some of the brightest sparks. And the great thing about IVF is it's such a satisfying profession. I mean, you change people's lives so dramatically for the better. And a lot of it is thanks to competition, costs come down, new technologies get adopted. What are some of the bright linings you see, Dr. Madhuri?
I think we have to we need to look at the patient as a whole. And I think with newer technologies which have come in, probably we can identify the patients who are at risk of losing their fertility early. We have different options. If the patient wants to postpone, we have an option of egg freezing so that even if they want to conceive after 40, they can do that. And I think if a patient has any genetic problem, we have an option of doing a PGT. But it is still questionable whether we should do it for all, because it has been shown that it really does not increase the live birth rates, but probably decreases the time to pregnancy. So actually, I would also like to tell the viewers that ISAR has got the Dr. Sadhana Desai Endowment Fund, wherein all the poor patients are given 50,000 rupees for their IVF, and the clinic can just collect money for the drugs so that the patient really benefits with it. And they have also generated a fund called as the ISAR Empathy Fund, wherein they provide drugs which are worth 50,000 to the patient, and the doctor can probably do the IVF at a minimal cost of 25,000 for the patient. So I think this is a great initiative from the society which serves the country, wherein we have these type of funds, and I think all doctors who are ISAR members can take advantage of these funds.
So I think that's a great point, and I think that's the other thing I was going to ask Parikshit. That the good thing about competition is because there's competition, automatically costs come down. In the early days when there was only one clinic or two clinics, basically they could charge whatever they wanted because the patient either would have to do it at their clinic or they would have to fly abroad. It's exactly the same thing with heart surgery. And I think to that extent, at least perhaps it's better that there is a little more availability of some of these options. There's more accessibility, and hopefully that will lead to affordability. But Parikshit, what happens if a patient comes to you and says, I've done a Google search and this is what I want you to do for me? How do you tell them, look, I don't think you really require that PGT?
Yeah, I mean, again, it goes back to what you believe is useful or what is going to help this couple achieve their, end target. Their end target is to complete a healthy family. So if you think that, okay, PGT is the way to go and there is a strong reason to believe that this couple would be helped, and if they've come with, some background reading, I respect that totally. If they've come with just, they've heard the name of PGT, then I educate them about it or give them some good, reasonable sources from where they can get good information. And if they have very, very fixated ideas that I will get pregnant only with PGT, then I think probably I would send them to another clinic.
Okay, great point. Anubhav, Because you run multiple clinics in different locations and you're in charge of them, I'm sure you see a lot of difference between pregnancy rates, success rates, fertilization rates. How do you deal with this kind of, I think it would be great if medicine was all black and white and you did something and at the end of it, but we all know even in our own clinics, you'll have good months and bad months and never be sure. How do you deal with that uncertainty?
Well, like you said, medicine is never an exact science. And thankfully, the way we have got clinics, we have doctors with varied levels of experience. So they've worked in different setups, their own setups and stuff. Quickly touch base on two aspects or trends, which I probably foreseen coming in the future, which is also important for the younger doctors who come into the space. One is as more and more insurance acceptance will come into IVF, and IVF does get recognized as a clinical need rather than just a lifestyle choice, you may see a lot of pricing regulation may also come into the space, which has probably happened in the space of transplants, cardiac, and all. That is one.
Especially when insurers start paying some of this money, that's
Absolutely.
going to be both good and bad.
You may
initially
see
it will be good because your volume will increase, and then afterwards, because insurers are profit-making organizations,
so price capping on drugs, etc., may come in.
That's the second point was yes.
The second was the more digitization creeps into every space. You will see a trend, and this is something all doctors and all of us also have to watch out. Is the trend of treatment going closer and closer to the patient. So patients will continue to demand the same set of clinical services in very different settings. And it's good point for all the doctors to sort of keep an eye on as to how do we become more and more approachable and visible at the same time.
Parikshit, I'll come back to you in a minute. Dr. Basab, you must be getting a lot of junior doctors who must be saying, can we spend time with you? Can we shadow you? Can we see how you're treating your patients? How do you deal with some of those requests?
Again, it depends on whether you're in one place or whether you're floating around. A lot of us in East India, they float around in different places. So it's difficult to get a person under your belt when you are floating around. If you're in one place, if you have your setup of your own, it's much more easy to mentor a person than doing it. It's like the Delhi government mentorship that you said. Like in medical organizations, we do try to do it from time to time. But as Dr. Madhuri said, it's good when it's under a training module, and if it's under a training certificate, like that would be working better than an informal one when you just want to mentor, as you rightly say, shadow. There's a lot of people who want to shadow. You can come and see a couple of surgeries, couple of procedures, but it doesn't ultimately add value unless you have a stamp to it.
Parikshit, you wanted to say something.
Yeah, I just wanted to come back to the point of results, what you were asking, Anubhav. And I think what we've realized, and this comes from our experience of, having worked at about 20 centers across the country, is that there is a learning curve. I mean, there's no way to get around that. And the second thing is the one-to-one mentorship that a doctor has, and how closely they stick to what are established result-making ways. I think these are the 2-3 things which help you to get to consistent results.
So I think it's great that you're again emphasizing the back to basics, the doctor-patient relationship, the doctor-doctor mentoring, so that the senior people can transmit some of what they've learned to the juniors. I think we're now going to start wrapping up, so I'm going to give everyone 1 minute. What message would you like to leave everyone with the audience? Dr. Madhuri, I'll start with you.
So I think all of us should have professional as well as patient advocacy, wherein we need to report the correct success rates and also do an ethical and evidence-based practice. And everybody should update themselves, because today a lot of changes is happening in the field of IVF.
Anubhav, I guess corporate hospitals would say, yeah, in any case, we update ourselves all the time. So, why do we need to be told this, right?
No, I think my leaving message will be, sustainable profits is more important. And the relevant technologies will probably be, like Dr. Madhuri said, not every technology really helps. So look at sustainable technology and sustainable profits. I think that's important for the doctors setting up their own setups.
Parikshit?
I'm talking to the doctors who are interested in entrepreneurship in IVF. I would like to only say one thing, and that is have realistic expectations of what you can achieve in this space. Go about doing it gradually with an understanding of where you're going. And again, the last thing to say is, of course, keep the center as the patient and keep that as your focus.
Fair. Dr. Basab?
Yeah, summarizing again everything what people have said. One is the ever-changing landscape of fertility care. You need to be at par, possibly a step ahead of what you're doing. And about if setting up your own unit, you have to be patient to get patients, and it'll take time. Nothing is an over a night. Sometimes you see the top rung of the society and you think I'll be like him or her one day. But I think there's no alternative to hard work and keep on going at it.
I think that's great. One advantage of being the moderator is I get to get the last word. So I think the only message I tell everyone is if you're going to do medicine, please don't do it for the financial income. Because no matter what you do, there are going to be far more people who are going to make far more money than you, working much less without all the risks, not as bright or anything else. But if you focus on the emotional income, the joy you get when you help an infertile couple to have a baby, that is unmatchable, whether it's a billionaire or whether it's anyone else. Because when people say thank you when they get pregnant after an IVF cycle, they say thank you to you. They look into your eyes. Every time they celebrate a birthday, they're grateful to you. And I think if you understand that's often far more important than all the money in the world, trust me, IVF is extremely gratifying and you'll have a great time.
Thanks a lot to each one of you. Thank you.
Thank you everyone for putting your point of view and knowledge around the topic. Now we'll take a short break.